Ever wondered about those uh, seemingly innocent belly button issues you might spot in a young foal?
Mm,
Or maybe why a mature, powerful stallion could suddenly be experiencing a very specific, agonizing, kind of acute abdominal pain.
yeah, those are definitely things owners worry about.
Today, we're taking a deep dive into equine abdominal hernias.
Mm.
Specifically, we're looking at umbilical and inguinal defects. Our mission, as always, is to take your sources, these comprehensive clinical guides and research excerpts, and really pull out the most important nuggets of knowledge,
You're right.
helping you quickly become truly well-informed about these common, yet sometimes incredibly serious conditions in horses.
That's exactly right. We're here to help you understand not just what these are, but, what actually causes them, how to recognize the signs,
Especially the urgent ones.
especially those urgent red flag ones, absolutely, and what the outcomes can realistically be. All of this, we promise, without getting bogged down in like super dense medical jargon.
Yeah, coup de clair.
Our goal for you is pure clarity and practical context.
Okay, let's unpack this then. Before we get into the specifics, what exactly is a hernia in a horse? What's the fundamental issue we're talking about here?
Okay. So at its core, a hernia is basically a defect, or you could think of it as a hole in the abdominal wall.
A hole, okay.
Yeah, and through this opening, fluid, or maybe more concerningly, parts of the gastrointestinal tract can push through.
Ah,
Now, it's absolutely crucial to distinguish between what we call a simple or reducible hernia,
reducible meaning.
meaning whatever's pushed out can be gently, manually pushed back into the abdomen.
Gotcha.
And then there's the complicated or non-reducible hernia. And that non-reducible part is really the key.
Why is that?
It means the tissue that's herniated is trapped or incarcerated.
Trapped, okay.
And if that trapped tissue, especially if it's intestine, has its blood supply cut off, which we call strangulation, well, that's an immediate, really life-threatening emergency. It needs surgery, like right away.
Wow, okay. So reducible, not so bad maybe.
Yeah.
Non-reducible, potentially catastrophic.
That's a good way to put it. Urgency is key.
All right, let's dive into the first piece then. Umbilical hernias. You often hear owners kind of casually call them belly button issues,
Huh.
but what exactly are these? And maybe where does that casual description start to become a bit misleading?
Yeah, it's a good question. An umbilical hernia is quite literally a protrusion of abdominal contents through a defect right at the umbilicus, the belly button.
Yeah.
And you're right, they are incredibly common, especially in foals, like probably the most common type we see.
And why is that? Why foals?
Well, the main reason is often congenital, meaning the foal is born with it. Essentially, the umbilical ring, which should close up completely after birth, just doesn't.
So it's something they're born with. I've heard some breeds might be more prone. Does that mean owners should be checking for this really early on, like right after birth?
Absolutely, yeah. There's definitely a suspected genetic component.
Yeah.
We see higher rates in breeds like quarter horses, thoroughbreds, warm bloods, even Friesians.
If-
So yes, early checks are always a smart move. But beyond genetics, things like trauma, say excessive stretching of the umbilical cord during birth,
Oh, yeah.
or an infection, something called omphalitis, that's basically an umbilical abscess that can weaken the tissues and stop them from closing properly.
Makes sense.
And even, increased abdominal pressure, maybe from a foal straining really hard because it's constipated or has diarrhea, that can make an existing weakness worse.
So lots of potential factors.
Yeah.
When an umbilical hernia is uncomplicated then, what does it typically look like for an owner? What are they likely to see or feel?
In those straightforward, uncomplicated cases, you'll usually just notice a soft, non-painful bulge right at the umbilicus.
Soft and non-painful.
Exactly. It can vary quite a bit in size, less than an inch sometimes, or up to several inches across. The good news is these typically don't cause any systemic signs like lameness or, a fever.
Okay.
And when you gently palpate it or feel it, you can often actually feel a sort of fibrous ring around the edges of that defect.
Okay, so a soft, squishy bulge that doesn't seem to bother the foal sounds manageable. But let's talk about the nightmare scenario for an owner at that moment when a simple belly button bulge turns terrifying.
Yeah.
What are the absolute red flags? The things that tell you this is not just a belly button issue anymore.
Yeah, that's the critical distinction, isn't it? While it's rare, complications like incarceration where contents get trapped.
Right, the trapped tissue.
Exactly. Or strangulation, meaning the blood supply gets cut off, those are incredibly serious. And it's usually the small intestine that gets
Oh,
involved.
boy.
When that happens, you'll see classic severe colic signs. We're
Yeah.
talking intense abdominal pain, rolling, pawing, sweating.
The whole 9 yards of colic.
Absolutely. And crucially, that hernia swelling itself will be rapidly getting bigger. It'll feel warm, firm, painful to the touch, and you won't be able to push it back in anymore. It's non-reducible.
Okay, that sounds bad.
And without quick action, this can spiral into shock. The horse's heart pounding fast, breathing becomes shallow, their gums might turn pale or even sort of bluish.
Oh, wow. And their capillary refill time slows right down. Their whole body is just visibly struggling. That's a sign of a severe systemic problem like endotoxemia setting in. It's an emergency.
Okay, that's scary stuff. You mentioned surprising facts earlier. Is there a particularly tricky type of umbilical hernia that owners or maybe even vets might miss?
Indeed, there is. It's rare, thankfully, but dangerous. It's called a Richter's hernia.
Richter's hernia.
Yeah. Imagine, like, only a part of the intestinal wall gets pinched or trapped in the hernia opening, not the whole tube, if that makes sense.
So just one side of the pipe?
Kind of, yeah. And this is insidious because the blood supply to that pinched part gets cut off. That's the strangulation. But because the entire bowel isn't blocked, the horse might not show those really obvious, full-blown colic signs you'd expect from a total obstruction.
So it's sneakier.
Exactly. It's more like a quiet, dangerous leak instead of a big burst pipe. Makes it much harder to catch early sometimes. Okay, good to know. So if an owner spots something concerning, how do veterinarians really nail down the diagnosis? And importantly, assess how severe it is?
Well, it always starts with a thorough physical exam. Looking closely, feeling the area, and attempting that reducibility test, can we gently push the contents back in?
Right.
Then ultrasound is incredibly valuable here. It lets us see what's actually inside the sac. Is it intestine or maybe just some fatty tissue called omentum? It also checks for any fluid buildup, which could mean trouble, and helps rule out an underlying infection.
Makes sense. What about more complicated cases?
Yeah, in those more complicated situations, a vet might perform an abdominocentesis,
Which is?
basically taking a small sample of fluid from the abdomen with a needle. If that fluid looks bloody or cloudy or just generally abnormal, and especially if lab tests show high lactate levels, well, that's a huge red flag.
What does high lactate mean?
It strongly suggests that part of the intestine might be ischemic, meaning it's losing its blood supply and potentially dying. That tells us we need to act, like, now. And it's also important, of course, to make sure we're not confusing the hernia with other swellings down there, like an infection of the umbilical stump itself, which is called omphalophleboides.
Got it. So what does all this mean for treatment then? Is surgery always the answer for an umbilical hernia, or is there maybe some good news for owners hoping to avoid that?
That's a great question. And no, surgery isn't always needed. There's definitely some good news.
Yeah.
Treatment really depends on a few things: the hernia size, the foal's age, and crucially, whether there are any complications.
Okay.
For many small hernias, let's say less than about 2 inches or 5 centimeters across in young foals, maybe under 4 to 6 months old, a lot of those will actually close spontaneously, just on their own.
Really? That's great.
It is. Manual reduction, just gently pushing the contents back in frequently, is something owners often do, though honestly, how much that actually helps promote closure is a bit unclear. You might also hear about veterinarians using things like hernia clamps or elastrator bands. The idea is to kind of pinch the tissue and encourage it to scar down and close.
Right. Do those work well?
They can, but they definitely carry risks. We're talking potential pain, infection, the hernia might come back anyway, or worst case, you could accidentally trap some intestine in there. So they're used pretty cautiously these days. Less common options might be things like hernia belts or trusses, but they're not seen as often.
So when do you know it's time for surgery? At what point does conservative management stop being the answer and surgery becomes the clear path forward?
Right. Surgical repair, which we call herniorrhaphy, is typically recommended if the hernia hasn't resolved on its own by, say, 6 to 12 months of age.
Okay, so if it sticks around too long.
Exactly. Or if it's quite large to begin with, maybe over 4 inches, or 10 centimeters even by 4 months, because those big ones are just really unlikely to close by themselves.
Makes sense.
And of course, any hernia that starts showing signs of complication, like it becomes non-reducible, painful, looks infected, or you suspect strangulation, that requires immediate surgical intervention. Period.
And what does the surgery involve, briefly?
Sure. It's done under general anesthesia. The surgeon makes an incision over the hernia, carefully puts the contents back where they belong inside the abdomen, and then meticulously closes that defect in the abdominal wall, usually in several strong layers.
Okay.
Post-operative care is important too. Usually involves good amount of stall rest, maybe 1 to 3 months depending on the repair, along with antibiotics and anti-inflammatories to manage pain and prevent infection.
And for the really bad ones, the strangulated ones.
For those strangulated cases, it's an immediate emergency surgery. The goal there isn't just closing the hole, it's getting in quickly to assess the viability of that trapped intestine. Can it be saved? Does part need to be removed? It's critical to do that fast to save the horse's life.
Right. Absolutely critical. Okay, let's shift gears now to inguinal hernias. These sound like, well, a whole different ballgame, and frankly, maybe more immediately alarming, especially for male horses.
They absolutely can be, yes. An inguinal hernia happens when abdominal contents, again, often intestine, pass through the inguinal canal.
Gotcha.
It's a natural passageway in the abdominal wall down in the groin area that's normally quite tight. In a hernia, contents push through that canal and end up in the inguinal region or sometimes right down into the scrotum in males.
Okay.
And while both sexes can technically get them, you're right, it's far more common and definitely more clinically significant in colts and stallions.
What causes these? Is it similar to umbilical hernias, like being born with it, or is it different factors at play?
It's actually both, depending on the age. There are distinct congenital causes, mostly in foals, and then acquired causes, which we usually see in adult stallions.
Okay, tell me about the full version first.
Sure. In foals, it's often congenital, meaning they're born with it. It happens because of a larger than normal opening called the vaginal ring, which allows the small intestine to slip down right alongside the testicle into the scrotum.
Ah,
This can actually be bilateral, affecting both sides, and again, we see it more often in certain breeds: standard breds, American quarter horses, draft breeds, saddle breds, Tennessee walking horses.
interesting.
And sometimes really excessive pressure during a difficult birth might also predispose a foal to developing one.
And what about in adult stallions? Why do they get them?
For adult stallions, these hernias are usually acquired later in life and typically only affect one side, so they're unilateral.
Okay.
They're often linked to factors that cause a big spike in intra-abdominal pressure. Think about the strain during breeding,
Right.
or intense bouts of colic, straining really hard to defecate or urinate, or even just really heavy exercise. It's like that pressure finds a weak spot or an existing slight enlargement of that inguinal ring and pushes through.
I see.
They can also sometimes happen as a complication after a castration procedure, though that's less common with modern techniques.
You mentioned different types earlier, too. Can you break those down quickly?
Certainly. There are 3 main types to know. The most common is the indirect, or sometimes called a true, inguinal hernia. That's where the abdominal contents enter the vaginal tunic.
What now?
The vaginal tunic, think of it as a thin sac, an outpouching of the abdominal lining that naturally descends with the testicle into the scrotum. So the bowel goes inside that sac.
Okay, got it.
Then there's the direct inguinal hernia, which is pretty rare. That's where contents actually rupture directly through the abdominal wall nearby, not within that tunic. And finally, there's something called a ruptured vaginal tunic. This is a real surgical emergency. The tunic itself tears, allowing the bowel to spill out directly into the subcutaneous space just under the skin of the scrotum or groin. That needs fixing immediately.
Wow, okay. So focusing on the more common indirect type, what does an inguinal hernia look like for an owner? Are the signs markedly different from an umbilical one?
Yes, they can be, especially when things go wrong. In the uncomplicated cases, which you see more often in young foals, you'll generally find a soft, reducible swelling down in the inguinal or scrotal region.
Soft and reducible again.
Right. It's usually non-painful, and the foal typically won't show any signs of colic. You can usually feel the pesticle right alongside the herniated loops of intestine.
Okay.
In some situations, particularly if that vaginal tunic has ruptured, you might even see, well, peristaltic activity, actual bowel movement, kind of rippling under the skin.
Whoa. Yeah, it'd be alarming to see.
It definitely catches your attention.
Okay, so that's uncomplicated. Now the emergency signs, the ones that are truly an emergency code red.
Right. For complicated, strangulating inguinal hernias, and these are incredibly serious emergencies at any age, but especially in adult stallions, the signs are acute and severe.
Yep.
Dramatic. You see this intense, sudden onset of colic. We're talking severe abdominal pain, pawing, rolling, sweating, rapidly increasing heart and respiratory rates. It looks bad.
So
fast.
very obvious distress.
Very obvious. And that swelling in the inguinal or scrotal region, it will be rapidly enlarging, feeling firm, intensely painful to touch, and definitely non-reducible. You won't be able to push it back in.
Firm, painful, non-reducible. Got it.
Then you get the systemic signs of shock and endotoxemia setting in quickly. The horse's gums might look pale or dark red, injected. Capillary refill time will be way too long, and the horse will just seem depressed, weak.
And the testicle, you mentioned that earlier.
Yes, that's a crucial indicator. The testicle on the affected side may become noticeably enlarged, very firm, maybe even feel cold to the touch, and it's exquisitely painful. That's because its blood supply, which runs through that inguinal canal too, is being compromised.
Oh, wow.
And unfortunately, that can quickly lead to irreversible damage or even necrosis, death of the testicle itself.
Okay, that paints a very clear, very urgent picture. Given how serious these can become, how do vets confirm an inguinal hernia and figure out the best plan?
Diagnosis starts, again, with a really thorough physical exam, looking at and carefully palpating the swelling, making sure we're differentiating it from other things that can cause scrotal swelling, like a hydrosol, which is fluid buildup, or maybe testicular inflammation.
Right.
A critical step, especially in adult horses, is rectal palpation.
Okay, what can you feel there?
A veterinarian performing a rectal exam can often feel an enlarged internal inguinal ring, the opening inside the abdomen, or sometimes even feel loops of small intestine actually entering that canal from the inside. That's pretty diagnostic.
Wow.
Abdominal ultrasonography is also really helpful. It can confirm that there's intestine within the sac, maybe assess its wall thickness or movement to get an idea of viability.
See if it's still healthy.
Exactly. Blood work can also provide clues showing signs of inflammation, dehydration, or that elevated lactate level, again in strangulating cases, indicating tissue distress.
And the fluid tap again. Abdominocentesis.
Yes, that can be used too, just like with complicated umbilical hernias, to check the abdominal fluid for signs of compromised bowel, like blood or high white cell counts.
Okay, so a multi-pronged approach to diagnosis.
Yeah.
What about treatment for inguinal hernias? Is it similar to umbilical, or is there a major difference, especially thinking about those emergency cases?
There are definitely some significant differences, particularly when it comes to those complicated strangulating cases.
Okay.
For the uncomplicated congenital inguinal hernias we see in foals, we often start with conservative management, similar to the umbilical ones.
So trying to avoid surgery first.
Right. This often involves frequent manual reduction. Sometimes vets will show owners how to gently place the foal on its back using gravity to help the intestines slide back into the abdomen. And many of these congenital cases in foals will actually resolve spontaneously on their own within the first few weeks to months of life. Sometimes hernia trusses or supportive bandages might be used, often combined with stall rest or just controlled gentle exercise.
So when do you decide surgery is needed for these inguinal ones?
Surgical correction is usually indicated if these congenital hernias fail to resolve by maybe 4 to 6 months of age,
Okay.
or if they start getting bigger instead of smaller, become painful, or show any signs of becoming trapped, incarcerated.
Right.
The typical open surgical repair involves making an incision in the inguinal region, carefully reducing the intestine back into the abdomen, and then closing that enlarged inguinal ring to prevent it from happening again.
And castration, you mentioned that.
Yes, this procedure is very often done at the same time as castration, either just on the affected side or sometimes both sides.
Why?
Well, partly because the testicle on that side might already be compromised from pressure, but also because removing the testicle and its associated structures allows for a more secure and definitive closure of that inguinal ring, reducing the chance of recurrence.
Makes sense. What about valuable breeding stallions?
Good point. For breeding stallions, where fertility is paramount, there are more complex, specialized, testy-sparing techniques that surgeons can sometimes use, aiming to narrow the ring without removing the testicle.
Okay, now the big one. The complicated, strangulating inguinal hernia. What's the approach there?
Right. This situation is a true, absolute life-or-death emergency, no question.
Get to a hospital ASAP.
Immediately. These cases demand immediate referral to an equine surgical facility. There's no time to waste. The goal is immediate surgical repair. Get in there, reduce the trapped intestine, assess its viability. Is it pink and healthy or purple and dying? Resect, meaning remove, any non-viable bowel.
Cut out the bad part.
Exactly. And then securely close that inguinal ring.
How do they get in? Same incision.
Sometimes the approach is directly through an incision over the hernia in the inguinal region. But for larger hernias or more complex situations where maybe a lot of bowel needs to be assessed or removed, surgeons might opt for a ventral midline laparotomy, a larger incision right down the middle of the horse's belly. It gives better access to the abdomen to handle the intestines and approach the internal inguinal ring from the inside.
Okay, and castration is pretty much a given here.
In stallions or colts with strangulating inguinal hernias, yes, unilateral castration on the affected side is almost always performed.
Why almost always?
Well, primarily because the testicle on that side almost invariably suffers significant ischemic damage from the lack of blood flow during the strangulation. It's often not salvageable. But also, as we said, removing it facilitates a really secure closure of that inguinal ring to prevent it ever happening again.
Got it.
For some non-strangulating cases or maybe recurrent hernias in valuable breeding stallions, there are even specialized laparoscopic, minimally invasive techniques that can sometimes be used to narrow the inguinal ring while preserving fertility, but that's more specialized.
Okay, and after surgery for these emergency cases?
Postoperative care is really intensive. We're talking IV fluids, strong antibiotics, pain management, careful monitoring, and strict stall rest for quite a while. The prognosis, well, it's often guarded to good, but it is highly, highly dependent on how long that intestine was strangulated before surgery, and critically, how quickly that surgical intervention occurred. Time is everything.
Time is tissue, as they say. Okay, so to tie this all together then.
Yeah.
What's the big picture takeaway? What should you, our listener, really carry away about these two types of equine hernias after this deep dive?
I think the ultimate takeaway, the thing to really remember is this. While both are fundamentally holes in the abdominal wall allowing things to poke through, their typical presentation and urgency can be vastly different.
How so?
Well, umbilical hernias are super common, often congenital in foals, and many times, thankfully, they're relatively benign and might even fix themselves, but you still have to watch them because of that small risk of strangulation. Inguinal hernias, on the other hand, especially the acquired ones in adult stallions, or any strangulating one, represent a much more frequent and immediate life-threatening emergency because the risk of intestinal strangulation seems significantly higher and the consequences are often more severe, involving the testicle too.
So location matters, age matters, and reducibility really matters.
Absolutely. The small intestine is usually the culprit organ involved in both, but the location of the defect and the anatomy down there just makes inguinal strangulation a more common and often more devastating emergency. The urgency is just different.
And just like that, you've completed another deep dive, this time into equine umbilical and inguinal hernias. Today, you've hopefully gained a much clearer understanding of these conditions, from spotting those subtle early signs to recognizing the critical indicators of a true emergency. You should now be much better equipped to see the differences and understand the potential urgency each one presents.
Absolutely, and that knowledge is truly valuable. Recognizing these distinctions, knowing when to call the vet immediately versus when to monitor, that can make a profound difference in the outcome for the horse.
Couldn't agree more. So here's a final thought for you to mull over. Given that many small umbilical hernias in foals do resolve on their own, what kind of diligent, ongoing monitoring does that really imply for you as an owner? How do you truly ensure your horse is completely out of the woods and catch any of those rare, unforeseen complications early on? Something to think about.